research question was, what repercussions does the growing opposition of vaccines have on U.S. society?
Imagine never being vaccinated. No horrible shots, no public schools, no immune system. Without vaccinations, the body is vulnerable to diseases that should be extinct. But because of the growing debate about the risks and benefits of vaccines, dormant diseases have risen again.
Radicals, calling themselves anti-vaxxers, argue against vaccines, claiming they do more harm than good and are unnatural.
These conspiracy theories are easily debunked with a couple of solutions, including more government funding, education programs that explain the importance of vaccinations, and stricter laws. One of these issues is indirect cost, as Mackenzie will explain.
The cost of vaccines disguises itself as free, but in reality, the indirect costs have led public and private sectors alike to refuse to distribute vaccines. The federal government buys 50% of the nation's vaccines. Despite this, medical sectors still pay a price. The VFC, or Vaccinations for Children's Program, vaccines can cost anywhere between $10.85 to $227.93 per dose for private sectors. This is significantly lower than Centers for Disease Control and Prevention, or CDC, practices that pay $9.46 to $144.99. The cost of vaccines isn't just the medicine alone. The VFC is adding to the cost with regulations and the need of special equipment. Insurance is needed for the vaccines in case a dose is destroyed or damaged. The VFC does not replace vaccines, even for public sectors under CDC. To prevent vaccines from expiring, expensive cooling systems are used. To regulate the temperature, a company is hired to monitor temperature. These extensive costs are fueling the anti-vax argument.
As Mackenzie said, there's a large financial burden on private sectors and patients. In order to lift this burden, we propose that we use government funding to pay for resources such as refrigeration, transportation, labor, and the base cost of vaccines. This will allow clinics to open in much lower income areas and provide a much safer society.
While what Nathan said is true, private sectors are independent from the government. The burden that rests on private sectors can only be lifted by their own funding. Government funding could help public sectors with insurance, refrigeration, and vaccine costs, but this would raise tax dollars. Travel costs and time costs cannot be fixed with government funding. Even with costs down, anti-vaxxers' minds won't be changed, which is why our solution has multiple parts, as Bruce said.
As you can see, coming closer to today, diseases have become much less common. But in the 1920s, there's a large spike that does not show that trend. This is due to a new disease that we didn't have vaccine for, influenza.
Many Americans don't know the inner workings behind the vaccine. People don't believe facts even when presented to them. For instance, Jonas Salk, the creator of the polio vaccine, showed that his vaccine worked by trying it on himself, his family, and other participants. In a matter of 2 years, rates dropped from 45,000 to 407, thanks to Salk. When people are misinformed, they tend to gravitate towards rash decisions instead of thinking it through. If informed correctly, vaccines can save lives. Matthew Daly also touches on the subject by mentioning the MMR vaccine and how people are 23 times more likely to develop a disease if not vaccinated. In contrast with the past, today, Walgreens gives out free flu shots to anyone who is willing and also concentrates their efforts towards promoting the free vaccine on TV commercials.
People who are unvaccinated pose a great threat to the physical well-being of America and can deprive others of their natural rights. Pro-vaxxers, like Bill Nye, realize this. There are also many studies that back them up. For example, in a study done in rural Texas, 10% of infected people were unvaccinated. That proves that unvaccinated people give vaccinated people diseases, as Bree's research led to. Also, anti-vaxxers like Jenny McCarthy refuse to believe this. In an interview with reporter Kate Stanton, McCarthy says she's treating her son's autism as a vaccine injury.
This is due to a study in 1998 when a prestigious British journal published a study linking vaccine linking autism to vaccines, which by 2010 was declared flawed due to the main author's misrepresentation of data.
Like Nathan said, numerous studies from places like WebMD, Centers for Disease Control and Prevention, and Children's Hospital of Philadelphia have shown this lack of connection. In fact, these studies changed the mind of young teen Ethan Lindenberger. As a child of an anti-vaccine mother, Ethan was always skeptical of his mother's opinions. He once showed her an article from the CDC, asking her why it contradicted everything she was saying. Her response was simply, quote, "That's what they want you to think." Despite the financial burdens which Mackenzie talked about, the simple-minded conspiracy theories of anti-vaxxers can go on no longer.
Because many sources linked disease outbreaks to unvaccinated people, there isn't much compelling and durable evidence for anti-vaccine. By educating the public, they will see the disease outbreaks and go back to science.
These sources also proved there was no connection between vaccines and autism, proving that anti-vaxxers are incorrect. If everyone was educated about vaccines with credible evidence, the world would be a much safer and healthier place. In a perfect world, this would be the answer to all vaccine problems. But because of the flaws in our society, the idea of educating the public has many limitations. For one, it's a complex idea and it's hard to understand how vaccines work, like Bree said. Secondly, there's no possible way to educate every single human being. Some won't pay attention, some won't listen.
Many people already believe pro-vaccine evidence is a fallacy. Who's going to stop them now?
Our most effective solution is to pass a law requiring those that can't get vaccinated to get vaccinated. In order to get this law passed, we would argue that when they don't get vaccinated, they are putting those with autoimmune diseases who can't get vaccinated in danger.
Restricted laws is the best option. Forcing life-saving medicine on people is forcing life-saving medicine on people inhumane. State legislators have implemented laws in the past and have received backlash, saying it impedes on their rights of philosophical freedom because they can't choose. School districts have resorted to mandatory vaccines for children to attend classes. As a result, parents are homeschooling their children, impairing their social and academic growth. Even so, what is more important, billions of lives or the rights of the select few? And this is our work assignment.
Okay, so I'm gonna start with you, Bree. In what way did you improve your ability to work with a group as a result of this project?
In the beginning, I kind of focused on myself and what I knew I was capable of in a group and what I contributed to as a group, but then working with Grace, Nathan, and Mackenzie, I realized that everyone has different perspectives on how they like things to work in a group, and we all put our learning types into account when having our presentation and also selecting who says what.
Grace, next one is for you. How did you decide to include Mackenzie's perspective, lens, or conclusion into the overall presentation?
So we knew that we wanted our overall presentation to be pro-vaccination, but a lot of Mackenzie's evidence was for anti-vaccination. So we decided to use hers as like a counterclaim. So we decided to put it at the very beginning so people know like what anti-vaxxers are like, what their evidence was, and like why they believe that. And then with our evidence, we kind of like, not like debunked, but like proved why pro-vaccination is better.
Nathan, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem the group identified?
I'd probably say Grace because her lens was the social lens, and it really showed how, like, Jenna McCarthy, that she thought that her son's autism was caused by vaccines, and that really helped me understand the other side of her argument.
Okay, and then finally, Mackenzie, what was the strongest counter-argument to the solution or conclusion your team identified, and why?
The strongest counterclaim to our solution was probably mine and Nathan's. Nathan had a lot of historical arguments, and he had a study saying that vaccines did cause autism, but that it was debunked. And mine was really just the struggles of cost. And Bree and Grace's were able to debunk ours and say they were efficient.